Okey, doktor.
Ya.
Doktor boleh buka doktor?
Dah.
Dalam. Okey, doktor dia nampak tak orang tu?
Dah communicate dah.
Dah connect. Okey, doktor.
Oh, sorry. Oh, tak dengar ya, doktor. Sorry. Okey, semula bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh kepada semua penonton Dr. Mami and Baby dan salam sejahtera. Sekiranya anda masih baru dengan FB page kami ni, kita adalah FB page untuk sebarkan info-info sahih berkenaan dengan Mami and Baby. Dan pada petang ini kita bersama dengan Doktor Prema daripada Columbia Asia Hospital untuk menerangkan tentang COVID-19 dan newborn baby. So terima kasih Doktor Prema kerana bersama dengan kami pada petang ini. Dan mungkin Doktor Prema boleh perkenalkan dulu diri doktor, education background dan berapa lama sudah doktor berkhidmat dengan KKM.
Hai, saya Doktor Prema Santara Sagran. Saya bekerja sebagai doktor pegawai perubatan almost now 11 years. 8 years I was with government and baru 2 tahun ni I'm in Columbia Hospital Emergency Department. So for past 8 years I was in medical department actually. Okay, I will mix the language if you all don't mind, bahasa Melayu dan bahasa Inggeris.
Boleh doktor.
Boleh ya, tak masalah.
Okay, santai je. So doktor, 11 years tu is a quite long journey. So being especially in emergency department memang sangat mencabarlah. Doktor mungkin dah tengok macam-macam jenis keadaan atau situasi dan belakangan ni kita digemparkan dengan pandemik COVID-19 dan doktor mungkin adalah antara frontliner yang sentiasa berdepan dengan isu-isu tersebut. Jadi pada petang ini kita akan mengupas topik berkenaan dengan newborn baby dan COVID-19, iaitu satu topik yang tak ramai orang bincangkan kerana selalunya orang akan fokus kepada warga tua, iaitu orang yang mendapat vaksin. Jadi mungkin doktor boleh beri sedikit orang kata pandangan doktor tentang what is the outlook or situation in the current state bila kita tengok baby and COVID-19 ni.
Okay, sebelum I go to that particular issue, let me just brief. We have been facing this pandemic almost going to be 2 years now. I mean more than 1.5 years. So it has been really a tough journey for everyone, including the frontliners, the government and everyone lah. So untuk baby biasanya kenapa kita biasa tak bawa perkara ni, because baby jarang menunjukkan symptoms. Okay, baby dan kanak-kanak dia jarang menunjukkan apa-apa symptoms. This is because when they don't, we will have symptoms like loss of smell, loss of smell, and then kita tak rasa and all these things. So we will tell we have all this. So that's why kita buat swab test and everything. But this mula, what we give, they drink, and then when they don't drink, we still force them to drink. So it hardly we actually detect the cases. And sometimes, as what we know, COVID is it's a viral disease, it's a self-limiting disease. So mungkin baby tu ada dah kena, and that 14 days of infection period, incubation period, and everything went on well, and the baby is out of COVID-19. So that's why the topic is hardly discussed. Bukan baby tak akan kena lah, baby kena. Compared to orang tua yang ada premorbid. Premorbid is when they have other diseases macam kencing manis, darah tinggi, cancer, asthma, anything. What happens? The severity adalah lebih tinggi. So that's the root cause actually.
So as you all know, baby mana boleh cakap nak bagi tahu.
Ya, betul.
Oh,
Baby boleh
tak
cakap.
boleh rasa
Dia
susu.
nangis, kita bagi dia
So,
susu
kita
dia.
hardly macam test or anything kan. So doktor, apakah peratusan ataupun what's the percentage untuk bayi dijangkiti COVID-19 ni?
Okay, in Malaysia we don't see, I think it's less than 1% at the moment yang kita tahu baby dijangkiti COVID-19. Case detected lah. Okay, recently because of VOC, we see more cases of variant of concern. We see more cases of kids yang kena COVID-19. So compared to our second wave previously, I think now it's more cases that been detected for kids and also baby. Yeah.
The numbers tu adakah dia dipengaruhi dengan number of tests that we perform on babies?
Exactly,
right?
exactly. That's definitely for sure. Now nombor yang kita detect case baby is dipengaruhi oleh case swab because apa berlaku? As what we say, adults they will have like dia pergi kerja and then they have contact tracing and a lot of things. So when we find one, then we find the next one. That's how we do the contact tracing compared to a baby. So when we know the baby, we will try to isolate them, and that's the reason why we don't really detect them. It's not mungkin diorang kena, as what I told. Maybe they already have the infection, but it's just that we don't know. Yeah.
So actually baby has the same risk lah if diorang exposed dekat mall ataupun ada dekat supermarket.
Okay,
so still can.
It's actually a very good question whether baby have the same risks like adults or not. The risk of getting COVID-19 is the same. Okay, whether they are it's the same. Whether they are infected, they are getting worse with the disease. That actually differs between kids and adults. That one, this is like something they are still doing research at the moment. Where for adults, we can use them as a subject, we can get the database, when your symptom and all these things. When it comes to baby, the research becomes more very tedious, lagi susah untuk dapatkan. So the risk of getting it's same. But what the good thing is, their baby's immune system, because of breastfeeding, the nutrition and everything, actually kind of protect them. Okay, so the risk of getting it is same. But whether the infection period, whether they're getting worse and everything, that is totally differs lah between baby and adults. When we talk about baby, I think we better talk about children in general lah. Anyone below 5, it's the same.
So that's why baby atau newborn baby especially kita tak encourage untuk bawa keluar ke mall ataupun
exactly, betul.
Right?
Betul.
Sebab it's not like macam baby tak ada like my sejahtera to scan kat mana dia orang pergi. It all like totally up to the parents.
Exactly. So we really don't want this has been going on for past 1.5 years. I think orang pun dah jemu dengar kita jaga kita, jangan keluar, jaga diri. I think at one point of time they're really bored of all this. So that's when they enter the boarding phase. They are very bored. So that's when they start. We can see our numbers of cases also rising rapidly.
Especially when
yes, exactly. So when after the previous lockdown, our first MCO last March 18, when we had a good MCO, we managed to bring down the cases to single digit. So when everybody was very compliant.
Yep, correct.
So sekarang it's a bit difficult. So that's another reason. When everything is over, so we start bringing our kids out. It's not we semua tak nak dengar. It's just that they are just tired of the same routine. Yeah, they are bored. So they start bringing the kids to mall and all these things. So you can see the numbers also rising rapidly for the kids. Yeah.
So okay, thank you, doctor. So what about the symptoms? Do baby face the same symptoms as adult, or do they not exhibit any kind of symptoms at all?
They do show the same respiratory symptoms: fever, cough, sore throat, tiredness, lethargic, myalgia, sakit kepala. It's a common viral symptom. It doesn't only happen for COVID. Anything, influenza, pneumococcal, anything, just name it, any viral disease. It actually menunjukkan symptom yang sama. So sometimes dia bawa baby ke hospital, and then let's say, it's current pandemic. Previously, before COVID, we will check for influenza. Now we are checking for COVID. So they actually show the same symptoms. And orang elderly people, actually, when they sesak nafas, at what I told you, they can tell. Budak kecil, if the parents notice, if they count the respiratory rate, masa baby bernafas, boleh nampak dia punya, we call resuscitation lah, dia punya subcostal
Dada
duration.
berombak, is it? Dada berombak tu ke?
Yeah, betul, dada berombak, yeah. So all that is also, it's like severe symptoms already lah. So tak boleh tunggu kat rumah lah, need to bring to emergency department as soon as possible.
So doktor, kalau baby ataupun children get infected with COVID-19, do they really need to do swab test atau diorang kena buat blood test, or either one pun boleh? Mana satu?
Swab test.
Swab test.
Till
So
now,
blood test is different.
Yeah, till now we're still using swab tests for babies. Yeah, we do have, now we have saliva tests, we have blood tests and everything, but mostly what we are doing now is swab tests. Like practice, yeah.
Ambil from hidung and mulut juga kan, doktor?
Yes, betul.
Okay. Alright. So,
Kesian lah nak cucu diorang kan.
Itulah sebab adakah blood test menunjuk tak accurate, ataupun kita boleh still nampak bacaan from bacterial infection ataupun viral infection?
Okay, blood test is very general. Like when we do something we call as a full blood count, FBC, we can see whether it's a bacterial infection or viral infection. When we talk about viral infection, we can see the counts are raised or reduced, we can see. But when it comes to viral, we wouldn't know which viral. Ada 1 juta lebih viral that we have, so we can't detect what viral are we talking about here. So that's why we're doing the PCR test now. That's more specific, yeah, for
More
COVID.
specific. Okay, doktor. So for baby yang infected with COVID-19 ni, do they have to quarantine themselves ataupun diorang boleh kena bawa pergi hospital?
Yeah, for 2 years and below, as recently, until last week, what was updated is 2 years and below, if COVID-19, they still get admitted for observation. Because they need to, actually check their saturation level, their oxygenation level, semua. So that's why they need close monitoring lah. So 2 years and below, they still need admission.
Oh, kena admission juga.
Yes,
tak boleh
they fall in high risk. They fall in a high risk category. 2 years and below, they still need admission.
Okay. So what about babies yang still breastfeeding? So mak dia kena ikut sekali ke ataupun nak kena pump and then
Okay. It's so complicated kan. Baby yang still breastfeeding and all. First of all, how if the baby is getting from whom the baby is getting the infection? It
from
doesn't
the mom, parents ataupun
kan. It's definitely someone. It's a close contact to them. Betul? So okay, katakan baby positive. Okay, this one happens very, very, very often in my hospital. When baby positive and then the mom is negative, but we know the mom is a close contact. So they can actually stay in with the child. But if it's other way around, kalau katakan baby negative, mom positive, then they can't stay in with the child.
Okay. Right. So to reduce the risk lah. So
exactly, yes.
To separate, is it, doctor?
Correct. Yeah.
Okay.
So it's very difficult. How you want to stop a baby from breastfeeding and bring the mom away if the baby is not used to bottle, bottle feed
and
all.
I heard that kalau the mom pakai full PPE, dia boleh breastfeed the baby. Tapi itulah, it's quite tedious lah untuk pakai PPE and then you have to.
How are you going to breastfeed the full PPE?
Betul. And then more 3 hourly kan. So especially newborn baby, every 3 hours nak kena breastfeed. So I think penat lah.
So usually memang dia akan need admission lah. Kalau anyone less than 2 years old, they need admission.
Admission.
And then,
At least for how long tu doctor? Selalunya baby how long dia akan recover selalunya?
It's same like adults lah. The recovery period takes 10 to 14 days.
10 to 14 days. So rawatan.
It depends on the first day of swab or first day of symptom. When we taking the swab, actually mungkin dia dah first contact dia mungkin dah 3-4 hari yang lepas. We wouldn't know exactly. Okay, so we are taking the swab, let's say 4 days after the contact, but we still take the example today is 10th, right? 10th of June. So we still take today's first day and then we keep for 10 days and we observe the child. Yeah. And
So
usually
without
because second week di mana dia akan manifest more symptom macam sesak nafas and everything. First week it's not too bad. Usually the trend that we are seeing now daily basis in my hospital and and what we've been reading, the second week is where they actually manifest more symptoms.
Okay, so tu I baru tahu, maksudnya the first week is not too harsh lah. So second week tu baru agresif sikit nak lawan.
Ya, betul.
Okay. So but what about the rawatan? Sama ke baby punya rawatan dengan adults?
It's symptomatic medication at the moment. For baby, adult, symptomatic medication, we hydrate them well, and then we actually give symptomatic macam batuk, bagi ubat batuk sesama, bagi ubat sesama, demam, bagi ubat demam. Kalau perlukan kita nak minum, we give drips. But when they actually enter the phase of like category 3, category 4, where they need oxygen and all, that's when we actually bring in antiviral. So for babies, it's very, very, very tedious. It's very selective. It's for kids consultant to decide whether the baby really need antiviral or not. So that's why they need admission. Like it's not like anyone can decide for them. No, the kids consultant akan ambil keputusan lah. So the management is almost the same actually. It's a symptomatic management, and yeah, you just support them. Yeah.
So untuk babies yang doktor tengok macam mana keadaan dia hari-hari, do they macam at one point memang akan teruk, macam tengah hari teruk, and then dia macam ni lah, maksudnya kejap okay, kejap tak okay, ataupun everyday tu macam diorang boleh cope lah with the infection?
Okay, you see, kids, when they are playing, if you're talking only about babies, or general as a kids, kalau masa diorang main and everything, they hardly tahu dia demam because they are very excited and they have this adrenaline rush. So they hardly know they are having fever or anything else. So when they usually malam lah, that's when tapi kalau viral, every 4 to 5 hours lepas bagi ubat, temperature akan spike balik. That is a typical symptom of viral lah. When you give medicine, after 4 to 5 hours, the temperature will spike.
Okay. Alright, so that's why anything is better to admit your kids lah.
Exactly, yes.
You don't know what will happen, right?
Exactly. You have your expert, you have nurses there, you have doctors there, you have everything that it's better to admit them, yeah.
So it's not just a typical demam biasa where you can just put tuala atas kepala and that's it, right? So this is
Now, of course, when you see the temperature is high, you boleh buat apa yang perlu, macam bagi ubat subrectal medication, bagi paracetamol, but just don't wait. Just don't do it every 4 hours. Come and get the baby tested because we don't know what is happening.
Okay, so with the new variant coming in kan doktor, so do you think yang one day kids pun kena ambil vaksin COVID-19 ni?
Okay, for now there's no vaccines that actually yang tak ada approved untuk kids. So far, you name any brands, nothing. Pfizer, AstraZeneca, anything, Sinovac, so far nothing they've approved for kids. They are still doing research and everything. So if we adults can actually achieve the herd immunity. Yes. So hopefully we don't. If it's good if we can actually dapatkan vaksin untuk diorang. Tapi kalau kita boleh achieve the herd immunity, that will be even better lah. So we don't pass the risk to the next generation.
So let's say for a family of 5, 3 got vaccinized, so another 2 is protected lah kan doktor? So basically no? At least 4
lah.
At least 4, okay.
Yeah, because when you talk about 3, that's only 60% kan, 60% saja. Herd immunity is anything, 4.
5, okay, that's a lot. So maksudnya in a family of 3, both parents kena
vaksin.
At least lah, tu pun macam borderline.
Correct. So when we talk about herd immunity, we are talking about community population besar tau. So when we actually sampai like 80% kita punya populasi vaccinated, at least I'm not talking color. So a lot of that it's at least something we can achieve. But now when we think, a lot of people say you are dulu, I want to achieve the herd immunity. It's very difficult. Everybody thinks that way. That's very difficult lah.
So that's why herd immunity bukan on a family level je lah, it's a community level, so everyone.
Exactly, everybody. Yes. So we don't talk about 5 people at home. So let's say only 5 of us are vaccinated in my house, but I'm going to work with another 20. So how to achieve? It's very difficult. Yeah.
So yeah, sekarang ni tak ada lagi children punya vaksin for COVID-19. So I
far
hope
tak
that
ada,
orang yang
so far tak ada. I know like Pfizer is doing some research for vaccination below 12, but still they haven't conclude lah. Tak ada conclusion. Tak ada. They haven't concluded whether can be given and all. So far no. So end of the day, it comes back to the parents.
Now it's 18 and above, right, Doctor?
Yes.
18
Yes.
and above, right?
Yes.
So yeah.
So that's why I say end of the day. Sorry.
So just say that to the viewers out there, if you're 18 and above, get registered. You have your cousins, your
yes, exactly.
So you want to protect your, nephew get vaccinated lah. But I know sometimes yang 18, 19 ni diorang tak berapa macam alamak. Should I?
Yes, correct. I think this a lot of 2K's kid when they do surveys and all this everyone is talking about herd immunity. They say when others take and then they don't need to take. So I think it's not fair lah, because it's not fair. Everybody have to take, and then that's when we can reach the herd immunity level. It's not like someone take and then we reach. It doesn't work like that actually.
Okay, I think we can try to answer a few comments here. Ada banyak Doktor soalan from our viewers. So let's try with the first one from Wani Azman. Okay, Doktor, apakah jenis pemantauan yang dilakukan oleh newborn baby yang disyaki menghidap jangkitan COVID-19? So what kind of pemeriksaan?
Observation lah. Okay, observation definitely we will check the SpO2 level. Kita akan check SpO2 level. We need to be always more than 95. We'll check the respiratory rate. Okay, and of course we will auscultate lah, see there's any lung infection, and we will do chest X-ray. And of course, we will make sure the child is not dehydrated. So we will check the input and output, urine output. Kalau tak cukup, and then if the child is not feeding well, and then we will start the child with drips. So these are the general pemantauan akan.
And SpO2 level hanya boleh dapat di NICU ataupun di ward kan Doktor? Dekat rumah tak boleh nak check. Any other macam medical device you can check the?
No, actually you have.
Oh, ada?
You have the portable one. You can actually, but of course.
Not very known lah untuk ada standby kat
yeah, if you have a medical personnel at home, then it's easier to do it. If you don't have, and then you better bring to hospital lah. Sometimes kalau sejuk dia tak baca, kalau you didn't put in proper weight dia tak baca. So I think it also cause panic and anxiety to the parents. Yeah. Okay, it's so easier to check for adults. So kids dia punya kuku capillary sangat kecil kan, so for when it's difficult to detect, so it's better to bring and check in the hospital lah.
Okay. Alright Doktor, moving on, apakah cara yang biasa newborn baby dijangkiti COVID-19? Adakah dari ibu mengandung yang positif juga atau ada cara lain yang dia boleh berisiko untuk dapat jangkitan?
Okay, so I rasa kat Malaysia ada report, ada laporan yang ibu positif, then the baby laki pun came out positive, but not too many cases. It's also when it's surrounding lah, it's the same thing, close contact.
Normally
mungkin
it's
ayah positif.
social
Yes.
interactions like kan Doktor?
Exactly, yes. So newborn, kalau it's newborn and mother positive, ibu positive, maybe it's from the mother lah, then we can't run anywhere. But let's say baby 5 days, 6 days dah pergi rumah, so it's a lot of contacts there, people coming in, baby baru orang akan datang lawat. So at this moment I think all that is not necessary at the moment lah. Later can do video call tapi tak payahlah datang lawat and all these things.
Okay, so moving on from Fatiha Muhammad Ali. If newborn baby positif COVID-19, apakah kaedah penyusuan baby tersebut? Bolehkah direct breastfeed atau kena guna PPE atau bottle fed je?
Okay, kalau ibu positif, anak positif, no issues. You can direct feed.
Direct feed, yeah.
Yes. Kalau ibu negatif, anak positif, it's you might need to think whether are they close contact or not. If they are close contact, I think you can still direct feed with PPE or face mask. Yes, no issues.
Okay, I think from previous life ada seorang nurse yang bagi tahu you can actually wear mask and then always wash your hands and all. But the risk is still there lah. You can still get infected eventually. Sebab rasa macam every day you have to direct feed. Direct feeding is like you do it every day on daily basis, every 3 hours.
Correct.
So macam the risk is high like I noted.
Yes, correct.
And then moving on, Intan Samsudin, is it true yang varian baru VOC lebih mudah menjangkiti bayi dan kanak-kanak berbanding varian yang dulu?
Okay, VOC. I think a lot of people actually nowadays asking about VOC lah, variant of concern. There's actually four, five, I think, including Kappa, Alpha, Beta, Delta, Gamma, and Kappa. There's 5 variants they're talking. It's actually a mutation from virus itself, from our initial COVID-19 SARS-CoV-2 virus. It's mutation lah. Any virus dia akan mengalami mutasi. So this is where we call it variant baru. And in Malaysia, I think there's 19 cases yang dilaporkan child yang meninggal, kanak-kanak bawah 5 tahun meninggal disebabkan variant baru ni. And that was one from Delta, another one from Gamma. Yes. So this is nama variant lah, Alpha, Beta, Delta, Gamma, Kappa. Kappa is, I think, they are still doing research with the variants. So they find the mutation and then they name it lah. So this is VOC. So the question is it true yang varian baru lebih mudah menjangkiti? Actually, yes. Bukan mudah menjangkiti bayi dan kanak-kanak. They have more symptoms with the variant baru. So that's when you feel, and it's detected. Now we know more kids have been infected.
So as opposed to initial variant yang awal-awal dulu, dia punya symptoms is just macam maybe coughing,
coughing, sore throat. That's why you can see every day our cases KKM report jumlah kematian. It used to be only single digit 3, 5, and now you can see it's, I think,
50,
a lot
less than 50 these days.
Exactly. So yes, it's because of that. So you see, we have to see as a population, like when the whole thing, banyak orang dapat, of course baby pun akan dapat. Banyak orang meninggal, the baby will be in that population that meninggal. So that is the thing. We cannot say dia hanya lebih, if you ask lebih mudah menjangkiti, I would definitely say yes, compared to what we had before lah.
So that's why we need to have extra caution these days about it's not the same. Kalau PKP 1 hari tu we really tedious, memang sangat OCD lah with everything. This time around memang kena extra lagi, kena careful.
Exactly, because for MCO 1, because as a doctor yang used to kerja hari-hari masa MCO pertama and all these things, I used to see, I felt wow, we are really getting somewhere lah, because everybody follows SOP. So now it's difficult to control. So I think this is the time we have to actually be more extra careful lah, because jumlah kes meningkat, jumlah kematian pun meningkat, baby, kanak-kanak semua they are getting it more easier comparatively.
Okay, so thank you doktor. And kita moving on to the next question from Nurul Soleha. Hai doktor, adakah terdapat risiko spesifik untuk newborn baby yang dijangkiti COVID-19 compared to golongan dewasa?
I think I've answered this question just now. The risk is the same. The risk is the same. Actually, it's the same.
Alright, so I think, okay, next question from Hanil Zura Hamzah. Doktor, newborn baby kan sistem imun dia masih lemah. So of course baby hanya minum susu ibu. Boleh doktor suggest any food yang ibu boleh ambil lebih supaya dapat kuatkan imunisasi baby?
Okay. Actually, what happens untuk baby yang baru lahir sampai 6 bulan dia ada, when baby is actually taking the mother's antibody and everything. That's why immune dia lemah when we breastfeed and everything. What happens, their antibody is also good. They actually, baby jarang jatuh sakit. Like they don't really jatuh sakit. Correct or not? So they take vaccine, 1 2 days they fever. It's not like until 5 6 months they jarang jatuh sakit. Okay, if you ask what any food yang ibu patut ambil, no lah, it's balanced nutrition. There's no this is what you're supposed to take, this is what you're not supposed to take. No, it's balanced nutrition diet would do. If you're breastfeeding, what is the nutrition you should take to breastfeed? Just take that. It's enough. Anything also should be balanced. Nothing you can ambil vitamin ni tinggi tak ada. Just take everything balanced way. That would be enough.
So what about ibu menyusu yang mengambil vaksin, the immunity from COVID tu akan pass down to the breastfed baby?
They are still doing the research.
They're still doing
That
the
part of
research.
it, they're still doing the research. Yeah.
Okay,
Because our vaccine is still baru berapa bulan kan, if I'm not mistaken,
Yeah.
even so research actually takes quite long, at least a year. So that's when they can actually prove this vaccine actually passing the barrier. This vaccine is not passing, so they need time. So I can't give that kind of data. Yeah.
For the time being, vaccine only protect those yang ambil tu lah. So if I ambil vaccine, it protects me. Whether or not it will protect my baby dalam perut ataupun my breastfed baby, still ongoing research. So that's
Correct,
the
exactly.
conclusive
Yes.
statement for the time being lah kan, Doktor?
Correct. So that's why I say for as current situation, to protect the babies, to protect the kids yang belum dapat vaksin, we adults yang dah ada vaksin ready, just go and take it, and we at least bring the herd immunity to the community lah. That would be the best thing.
That would be the best. Okay, thank you, Doktor. So I think that covers the topic for now. So mungkin Doktor ada a few advice bila Doktor bekerja dalam institusi kesihatan and Doktor tengok what's going on with the community sekarang. Sekarang kita PKP, but what if it's not PKP? You see how people mungkin dah penat. So what's your advice, and actually practical advice lah, what do we have to do in this current situation, or maybe any advice to frontliners juga yang sekarang ni maybe dah, you know, dah penat, dah overwork. So any advice at all?
I mean, I don't have advice for the frontliners because they've been working since the first MCO. So they exactly know what's happening, and I think no one wants to work like this, and tak ada orang suka berkurung macam ni lah in 2021. No one likes all this, but then it's just that we don't have a choice. I think that there's a lot of frontliners like tak dapat pergi tengok anak, baby that we were discussing and everything. They are working 18 to 20 hours per day. You know, it's not easy. I'm not only talking about the doctors, I'm talking about frontliners in general, anyone, the doctors, nurses, police and everyone. So yang given the chance untuk bekerja dari rumah ke, you know, just I totally agree with the statement, kita jaga kita. I think we are all adults, we want to protect our kids, we want to protect the next generation. The only thing we can do is take care of ourselves and take care of our family. That's the only thing we can do. So just follow. If everyone can do what they did for the first MCO, things will be better. As what you said, I think the frontliners are really getting tired already.
Yeah.
Like, you know, every day wearing PPE, every day seeing COVID patients. Everybody has a threshold. So we really don't want them to sampai that threshold lah. We've been hearing the ICU penuh. We have seen a lot of clips. Nurses menangis, doctor menangis.
Breaking down.
Everybody like menangis. So I think it's the only thing we can do is just take care of ourselves, take care of our family, and just do what is supposed to do. I think a lot of people ask me questions like, vaccine will have this side effect, that side effect. I say yes, of course. Even makan Panadol pun ada side effect. So ni vaccine lah. This is something they just they just brought to the market and everything. Of course got side effect lah, but yang buat vaksin ni, it's so many people yang knowledgeable, and they have been studying for this for so long. They want everyone to live as normally tau. So we have to end of the day, for me, just vaccinate, go and register, and then social distancing, pakai mask, sanitize, kalau tak perlu tak payah keluar. That's it. So I think people are bored of the same advice. I don't want to advise the same thing. Just do it. Buat apa yang kita tahu lah. That's the only thing.
But I think if kita penat, what more the frontliners yang every day has to go to work and face the same thing over and over and over for the past 2 years. So macam it's not fair to them. So you know,
Exactly.
at one point macam do it for
Yeah,
the sake of frontliners pula lah. And don't be selfish and say alamak aku nak ni kan.
correct. I think because we don't get the privilege of to work from home lah.
Work from home,
Betul tak?
yeah.
Yeah, so yang dapat privilege to work from home, I think they should do it properly. Just jangan menyalahgunakan your privilege lah, that's it.
Okay, thank you so much Dr. Prema. So I have a question to all viewers today. So siapa yang dapat jawab, please drop the answer in the comment section. So soalan ni senang je, doktor dah cakap tadi. So adakah ibu yang mengandung boleh pass down ataupun ibu yang menyusu boleh pass down dia punya COVID-19 to anak dia? Kalau boleh, melalui apa? Adakah melalui genetic, inherited ataupun social interaction? And for the winners boleh dapat this bag from Columbia Asia Hospital, ada bekas makanan, ada mark from Columbia Asia. So okay, nanti I akan check siapa yang ada jawab tu, saya akan pick the winner. So thank you so much Dr. Prema Santara. I think this is a very great session. I enjoyed this session a lot. So I hope in the future kita boleh collaborate lagi lah doktor.
Okay, sure. Thanks a lot for asking questions, because if you don't ask, I will definitely don't know what to answer.
So we hope for a
out there,
better future kan doktor. So I really hope this the number will gradually decreasing lah. So
yes, let's just pray and listen to our DG. So
right.
hopefully the numbers will come down and all of us can just go back to our usual life.
Yeah, I miss meeting people in person, you know.
Time.
Yeah.
Correct.
Really,
Yes.
you know, like hugging people.
The celebration, everything, traveling, everything is gone. So I think that's another reason people are getting, going into depression and all. So I think, hope everything will be over by this year, hopefully. And then, hopefully 2022 will be a better year for all of us.
Inshallah. Thank you so much, Dr. Prema.
Okay, thank you.
That's all for today. Have a good day, doctor, and everyone.
You too. Take care.
Take
Bye-bye.
care. Bye.